Hi, everybody. Welcome to GWCIM and Ms Drapeau's podcast. So today we're starting the topic of long COVID or post-COVID long non-recovery. And I invited Ashley. And so in this last couple of months, right, we had two practitioners who joined our practice. Then I can't say their last names. So it's okay. I'll learn. I'm learning, Jennifer. I think that's all right. So let me try this one. So Ashley Drapeau. No, that's wrong.
Drapeau. It's fine.
That's not so bad. Okay.
It was close. It was good.
Yes, I don't know why I'm having these problems with French pronunciations of last names, but okay. So Ashley just recently joined us. She'll tell about her practice. She is also at GW at the newly formed wellness office, and she'll tell us about her job there. And her interest has been for personal reasons, partially, but also partially by her training long COVID. So today we're going to talk a little bit about her practice, and then we're going to swing in the second half of the conversation to talk about as of in sort of entry into long COVID and how we're treating it. And in a couple of weeks, we're going to have a much longer long COVID open house. We're going to invite leaders from GW medical faculty associates who are actually running a much larger clinic than what we do. Then we're going to talk about kind of an overall strategy and treatments and all things. And we'll invite anybody who wants to come in and join this, and we'll record it so people can watch it. So Ashley, welcome.
Thank you
so much for joining me today and for just joining the center. We're so excited to have you. Let's start out. Just tell the listeners a little bit about what you do, your background, and a little bit about the Wellness Center.
Yeah, thank you so much for having me, and I'm really excited to join as well. So my background is as a physician assistant, and I've been one for a little over a decade. Actually started in a really collaborative environment in bariatric surgery, which I really enjoyed, and then joined the military actually, and was active duty Air Force for about 6 years. Doing a hodgepodge of things, but mostly family health. And so I think that's where I started thinking about integrative medicine and where the wheels just started turning about how patients would come in with these disease processes that were very complex. And you would send them to, A, B, and C specialists, and there weren't many answers. And people would be really frustrated. And I was really empathetic to that because I really wanted to help them. And that's why I went into medicine. And so I think that's where I started thinking about that, and also thinking about the relationship of stress and disease as well, and how they're really just one and the same. And so when I got out of the military and was thinking about sort of what my next steps were, and how I wanted my career to go, I really wanted to do something if I was going to go back to school that I thought would benefit medicine as a whole. And so I decided to go to school for acupuncture. And that's when I started sort of my Chinese medicine journey. And, at the same time of going to school to get my master's in acupuncture, I was also working as a PA just to keep up my skills in urgent care. And that's when the pandemic hit. And so, that's where my relationship with COVID and long COVID started, because I actually, got COVID in December of 2020 while working with patients, and had
This was a pretty early. I mean, I think I think we talked a little bit about this before, but just want listeners to hear this. So you probably got the Delta variant, we're all assuming, right?
Or even prior.
Or even pre-Delta, right?
Yeah, pre-Delta.
Yeah, so you had one of those more severe strains early on. And so now we think that percent of people who get post-COVID is pretty high, but back then it was even higher, I think. So you tell us a little bit about sort of, if you don't mind, of course, tell whatever you're comfortable sharing as to sort of what happened to you.
Yeah, absolutely. So it was shocking for me. I got COVID. Back then, it was a 10-day sort of isolation. So I isolated from my family and just rested, the entire time. And I honestly had very mild symptoms, high fevers, things that are common of a flu type virus. And until probably about day 10. And then I felt like I couldn't breathe. And it was scary, honestly, especially, the fact that I didn't have any other comorbidities. I didn't think I wasn't, morbidly obese, some of these things that I think the conventional medical community is talking about that leads to sort of
Mhm.
bad outcomes in COVID. I didn't have any of those things.
Well,
So
you're also integrative practitioner. You were taking all the right supplements, and you were doing everything you were supposed to be doing, and yet it's lingered.
yeah, and yet it lingered. Yeah. So I think shortness of breath was one of my first real sort of wake up symptoms of long COVID. And then it sort of trickled from that. So then I started getting migraines every single day. I started having this really awful bodily fatigue and brain fog.
Mhm.
And I would say that those are probably my biggest symptoms that I've had to sort of struggle with. And
Mhm.
even now, a lot of things have really improved. I've been doing a lot of different things, but even now, there's some fatigue that still lingers. There's some brain
Mhm.
fog that's still there. So
Mhm.
it's a long process.
I wanted us to talk a little bit about your new position first, but we sort of swing into post-COVID, but I think that's okay. I think let's just go with that because I think it's just more, it's just flowing better that way, I think. So how did you start getting out of this? Like what actually helped you?
So I think one of the things that differentiates me and some of the groups that I'm in different support groups for people with
Mhm.
long COVID, especially other medical providers with long COVID, because I really resonate with them, is that I really sought out my own answers. I wasn't waiting for my long COVID or post COVID doctor to have all the answers for me. I sort of thought about my integrative background, said, well, what can I do for myself? Who can I
Mhm.
reach out to? So I
Mhm.
reached out to, my acupuncturist. In the beginning, I was seeing her twice a week. I was really all in on that. I was reaching out to somatic experiencing to learn vagal nerve exercises to
Mhm.
help any dysautonomias, which we can talk about later, but is really popular with post COVID.
So just for our listeners, real quick. So those of you who've been following some of our practice growth and some of our prior conversations, like for example, for past weekend when we actually had Angela Gabriel talk about somatic experience. So all of this has actually been thought through in advance. And so because we've starting to realize that the post-COVID is not going away. And so we start realizing what can we do? What are we seeing is effective? And so what Ashley is describing is what we're actually seeing work. Not just take this vitamin, go to this physical therapy. And I mean, certain things kind of now done as a standard for post-COVID in academic centers, but we don't really think that works really well, do we? I mean, we're seeing that it's still very limited, and we'll talk about this in open house. We'll get together in a larger group, and we'll try to give listeners a lot more precision and a lot more conversation on not just what we do, but what other large academic centers are doing. But actually, this is your path. So somatic experience, acupuncture, and what else?
And I met with a cognitive therapist who really worked with me to pace. That's
Right.
super important, especially when you're talking about post exertional malaise or fatigue. That was really important. And I think that those were, oh, and I also met, I think this is important to mention too, with a psychotherapist who did some pain reprocessing therapy with me, which really focuses on the amygdala in our brain and the cycle of how pain is sort of driven by fear. And if we're, especially when you're talking about things like migraines, if your body is always in that fear response and your autonomic nervous system is always triggered, then
Mhm.
you're just going to have worsened pain. And it's sort of going to be this loop where you feel it coming and you expect it to be bad. And of course, it's bad.
Mhm.
And so it's trying to get out of that loop. So yeah, I mean, I worked with conventional medicine as well. So I think I will say the thing that I hope to bring is some of that all in one place in person so that, one of the things I struggled with while being really sick was that making all these appointments, all
Yeah,
these
right.
phone calls, it's
And
too
and
much.
it's too much, and then often it's not even all in one system, like, right? Like you had to probably
Oh,
reach out to different institutions, and if everything's on the same roof, it's a little bit easier, but when you have to talk like different places, it makes it even harder. Yeah.
right, right.
How does
Absolutely.
qigong fits into this? Because I know you're a deep practitioner of it, and I'm just curious, what did you do in that sense? Like, have you rechanged your practice? Have you adjusted it somehow, or what?
I have adjusted it. I tend to avoid a lot of qigong where I have to do a lot of leaning down and getting back up because I feel like that can be really triggering for me in terms of migraines.
Mhm.
Or some of my other post-COVID stuff. So I tend to do things that are more upright or more grounding, sort of bringing the energy down away from my head, which I found to be really useful. And so yeah, I still do it as an adjunct to acupuncture for sure.
And I think you and I in upcoming weeks can talk about CBD. I do think that some cannabinoids in your situation may be useful. I have seen that not just with post-COVID, but for general migraines, when they really migraines, not necessarily for general headaches, but for migraines, especially when migraines are triggered by excitation of any kind. I think CBD may play a role. But anyway, that's a side note.
Absolutely. Yeah.
So, well, so you're, despite all this, right? So you not only joined GW, Office of Integrated Wellness Center, but also our clinic. So talk a little bit about this, kind of sort of how do you, like, what do you do on your day-to-day basis? I mean, you're busy.
Yeah, so it's interesting because while I was going through a lot of these treatments, I basically took a year off from, seeing patients.
Mhm.
And that was really hard for me. I really like being productive and feeling like I'm making a difference and having a purpose. So that was really hard. So, I think I first got in the GW system when I started working for the Resiliency and Wellbeing Center. And that really resonated with me too, because, I think about our healthcare system and our lovely professionals that are really struggling right now, working in medicine. And, many are leaving altogether
Yeah.
any clinical medicine at all because it has gotten so bad. And so I think that burnout really had a part in me having these lingering symptoms. I really believe that stress sort of mixed with, COVID was just not a good combination. And I think that, many other people would probably agree, depending on where they were in their life when they started developing long COVID. So on a
Instead of,
day-to-day basis, oh, go ahead.
instead of leaving medicine, you decided to take action and do something about it.
I did, but I'll tell you, it's a struggle,
Of course it is. Never easy.
No, and medicine is a rigid culture that many do not want to change or, find some sort of value in sort of working ourselves to this point where we become sick.
Mhm.
And not really having this balance of taking care of ourselves. And I learned that too when I was in school for acupuncture because we had to take self-cultivation courses. And
Where'd you
I thought,
go? Which college, which school of acupuncture you went to?
so I went to Maryland University of Integrative Health in Maryland, yeah. And they really, I think that they find a lot of importance on cultivating yourself before you even meet with patients so that you yourself are grounded and taken care of and can really focus and be present for that other person. And that blew my mind. I got to tell you, coming from Western medicine,
Yeah, we don't learn that. We're kind of just expected to know it somehow by
right,
being
but we
there,
don't,
and we
right?
don't.
Like, who knows that coming out of school and is able to do that? And I see it now when I see other practitioners as a patient. I see it, I'll see a person and they're sort of all over the place.
You're right.
It's almost like getting information from a water hose being sprayed at you. And I'm thinking to myself, oh man, this person is really stressed and probably really needs to take a minute and just breathe. And I don't know if I don't think it's their fault. They probably don't even have
They
time
don't
for
have
that.
time, they don't have skills, they're told that, yeah, or they're not told, but they're assuming that there is no real place for it, right? I mean, there's an
Yeah.
assumption that we have to be above all this somehow, you know, and that we're superhumans and we just, you know, and then a lot of people, as you exactly what you said. I mean, I didn't look at the statistics in preparation for this, but I mean, there's been a huge leakage of people, and you know, like in our own institution, I've seen a lot of people who were close to retirement. They just retired. They didn't want to deal
Oh,
with
yeah.
this, and then a lot of people just left for various reasons. But it's been very painful to see the shift, I would say, from my end, because, you know, I established a lot of relationships with these people, and now it's not only establishing new relationships, that's okay, but it's just, you know, seeing that patients at the end of the day, it's actually patients who end up getting worse care because relationships are gone, and it's a lot harder to get the care coordinated well.
They do, yeah. And a lot of my colleagues, especially the ones that work in, you know, emergency medicine or even trauma, are seeing this huge influx of new grads and really no one to mentor them
That's right.
at all, you know, because there really isn't many people there who have any experience to even mentor these young professionals that are just being sort of thrown into the mix. And that's creating its own problem too. So, and it's not helpful for patients to go into an emergency room that's run by nurses that are brand new out of school, you
Right.
know. So we really need to look at the healthcare system and make some changes and be honest with ourselves. And I think it's on it's
Well,
multiple
and
levels.
I think you sort of entered the wellness office in perfect timing, because I think the GW strategically has been thinking about this, not, you know, just practitioners, but like leadership, and hopefully that's not. And also, thank God we have a funder, right? That said, here, go do this. And so Dr. Lorenzo Norris and Lee Frame are leading this new system. But tell our listeners a little bit about sort of what's practically out there. I know it's really not for patients yet. We'll definitely going to be talking about this in upcoming months, but the current office is more for actual staff and faculty and students, right?
So it is, yeah. It's working with students, faculty, staff, residents. And, you know, within the medical enterprise, there's the medical school, there's the PA school, there's the PT school. So we work with all of those students as well.
Mhm.
And a lot of it is workshop based. I really try to get an embodied experience in those workshops. So doing some sort of, you know, progressive muscle relaxation with them, something that they can feel in their body that feels different, rather than just listening to people talk about what's a good idea that you should add to your life. It's sort of, you know, what is reasonable that I can take with me, and how can I feel it in myself, the difference between how I felt before I did the practice and after, because that's a game changer. If you
Mhm.
can't feel the difference, why do it?
Right.
You know, you have to be able to have that embodied experience. I really
Mhm.
believe that. And so it's that. And then also we do individual consults with individuals who reach out to us who are struggling, and try to get them the resources that they need, you know, whether that be therapy, or we've even had people want nutrition resources. So it's whole health, really. Um, Trying to
So
get them.
yeah, it's basically, I think, the first step in creating this, instead of keep the rest of the GW medical faculty associates is really all about medical care. I mean, there is some beginning of wellness establishments, but I think this is a real true breakthrough for GW to have the whole center dedicated to wellness instead of illness.
Yeah. And I think it also speaks to the levels, right? Because you have to start having people learn in school that
Mhm.
taking care of yourself is important. You have
Right.
to start that thinking process so that when they do get into the MFA, if they're going to stay at the GW or wherever they're going to go,
Mhm.
they're already thinking about that they're already relating to
Mhm.
that. So
Right.
hopefully that changes the culture of where they're going. And then, you know, there's also this organizational piece or this institution piece. You know, there is an individual responsibility, but there's also an institutional responsibility to take care
Mhm.
of their people as well.
Right. So tell us a little bit about your practice. So you're acupuncturist. You do a full spectrum of Chinese medicine, not just acupuncture.
Yes.
And
Mhm.
then you're integrating it in with your Western background. So So just maybe a little bit about, again, and I don't want us to sort of concentrate on a post-COVID now
Right.
specifically, because we're going to have a whole meeting about this in the upcoming few
Sure.
weeks. But just overview for listeners, like if they want to see you, what would the experience going to be look like for them?
Yeah, what can they expect really? I think that's a good question. So I like to look at everybody as an individual. And that means that I take an inventory of basically their whole health. So not just what medications you're on, what allergies do you have, what medical conditions you've been given, but also, what is your sleep like? What's your diet like? What's your everyday like? Do you have kids? Do you work from home? Do you work outside the home? What are also your goals? Because I think that what I've always been told is that we have to sort of create goals for patients, but patients should create goals for themselves, because every person has something different that's important to them. And I think that's sort of the art of medicine, is sitting with somebody and determining in that period of time what they value and what's important to them. So for one person, that could be, I just want to be able to play with my kid. I just want to be able to have enough energy that I can, play a game with them. Or for another person, that could be, I'm in the middle of writing my thesis and I really want to finish it. And so everybody has different things that they value, and that's okay. And so it's trying to be there as a support to get them to the place they want to be. And so, for me, I think that it's being an ever presence in their life so that they have somebody to go to that understands them from both a conventional sense, all the disorders that they may have and all the medications they may be on, because I definitely have a lot of experience in that, but also what else can we do, like what's outside the box that we could offer to you to get you where you want to go, that's outside of just adding another medication. So yeah.
And I'm thinking probably a lot of people with chronic fatigue would really benefit from seeing you, even if it's not COVID related. I think there's, especially since pandemic started, even people who have not had COVID often tell me that how tired they are. A lot of people simply don't move enough, but it's much more complex than that. I think there's a lot of trauma going on a national level. There's a lot of stress that's not managed well. There's lack of movement. But I think there's also other things. I mean, I think people get other illnesses. I mean, those other illnesses not going anywhere. I mean, they're still there. And often, especially in the first year and a half of COVID, a lot of people get put a lot of things on back burners, and they just were not addressing the certain things.
Oh yeah, there's other stuff that existed, prior to even COVID, like chronic Lyme disease,
That's right,
for instance, or people who get Epstein-Barr virus and end up with, POTS and other dysautonomias after that.
so this is
there,
some of the good conditions for people to see you for, correct?
oh, absolutely, yeah, absolutely. Acupuncture can be really magical for somebody who's been dealing with a lot of fatigue for a long time. I've seen that very often, where I've either done acupuncture myself on the person, or I've referred them, to someone else, and they've really found it beneficial. So there is this sort of thought process. I think if you see a Western provider, they're probably going to tell you, well, you should do some physical therapy and recondition and sort of push yourself, but that causes a rebound effect and generally a crash. So it is a little counterintuitive there.
Right. So for now, your visit's going to be individual in the beginning with us, with the center, with the GWCIM. But I also envision that we're going to start getting some of the classes organized. I mean, I think you're a wonderful speaker, and you're very articulate, and you've been teaching at Wellness Center, but you also you've been at our Friday afternoon GW and AIM podcast, or just we have a 2 to 3 p.m. every Friday. For those of you who are listening, we have a free event on Zoom, just like this one, but with teachers who are talking about COVID, but also talking about different mind-body practices. And so Ashley has been teaching there now several times, and hopefully we'll come back to teach some more. But I also think that you would be a wonderful class leader and facilitator, and I hope that once things get a little experienced with the clinic, as you learn our family dysfunctional family, as we sometimes call it, you'll bring more functionality. That's my personal hope, but also that we'll do more classes. I think that's just obvious. Classes save money for people and they create community, and it just makes a lot of sense. And actually the GW post-COVID clinic has been asking me to start classes because there's currently nothing available, no
Yeah.
formal support group.
People are really looking for that. I can tell you from being in the post-COVID community myself, everybody is looking for that community. They're looking for that support from each other. And it's hugely beneficial to have people that you can relate to that are dealing with a lot of the same issues that you're dealing with. As well as, like community acupuncture can be hugely beneficial, just auricular acupuncture as a microcosm of the body. So
actually it's a great idea. We currently do have space. COVID is slowly easing up. So that's one thing for you to think about. I mean, if you want to start, we used to do it. Back in the day, we had few episodes when we did community acupuncture for our students. And that was very well accepted. So I think you probably going to consider doing the same for the wellness center, but we also can do that for patients at the clinic. So just putting it out there. Well, I think we're coming on to the end. I try to keep this always under 30 minutes to respect people's time. So maybe last couple of closing thoughts. Anything you want to convey to our listeners?
Yeah, absolutely. I think that the most important thing to convey is that whatever you're feeling is real. It isn't in your head. And it just takes one person to believe you, to be able to give you hope, that there is hope, that you will get better. And it takes time. It takes time and, the right person. So
true. Well, thank you. Thank you, Ashley, so much. Hopefully by the next time we meet, I'll memorize how to say your name right. And but we'll meet soon. We'll meet with a larger group. We'll have an open house in upcoming weeks. I think we'll in the next week or two, we'll give a precise date so people can start thinking. But even if you can't participate, if somebody who's listening now really want to join but can't, everything's going to get recorded. You'll have an opportunity to watch it on our YouTube channel. And we'll see you soon. Ashley, thank you so much for coming in. This is the beginning of a wonderful place for practice for you, and really bringing the improvement in how we deal with long COVID and just how we make people well and better.
Great. Thank you so much for having me.
Thank you. See everybody very soon. This is Dr. Misha Kogan, GW Center for Integrative Medicine podcast. Have a great week.